Welcome, friends. We have been on our journey to study homeopathic remedy Spongia toaster, and this is a part 6 which deals with the first grade representation of Spongia toaster in the rubrics of Reversed Kent Repertory. And this is a very important study which involves the Kent Repertory to gain the insight how Spongia has been represented. Already we have seen in the works of Hering's guiding symptoms what kind of symptoms are there, what kind of representation of those symptoms are there, how first grade area is being given represented in the Hering guiding symptom. Similarly, in this section we explore through the lens of reverse Kent repertory or Kent's point of view to identify those rubrics where the remedy holds a first grade priority, giving us its most decisive clinical indications. So we'll go ahead, friends. I am Dr. V.K. Chauhan. A few things about Kent repertory. It is the repertory of homeopathic materia medica by J.T. Kent, and its philosophy is that it works on the deductive knowledge from generals to particulars. Here the symptoms are classified into mental general, physical general, and particular generals. The gradation is very important. The first grade symptoms are those which are being represented in the bold letters, which have got 3 marks. But here in the current work we are given them the bright red color for our convenience. Second grade symptoms are italics, and third grade symptoms are ordinary font, black and white. So we go to the study of Spongia through this work. We will find approximately 37 sections. These Kent repertory up to 6 sections, there were only 37 sections, which included 5 sections which belong to urinary system. Now, in the mental general, you will find important rubrics. They contain Spongia as a first grade representation, mind starting sleep from sleep, mind weeping heat during. In the head region we have pain, ascending steps. In the nose we find nasal dryness from inside, and in the face we have heat, motion after, perspiration of face, and this is a cold perspiration. In throat we will find throat choking, constricting, throat pain, sweets aggravate. We find across the line, like in Hering's guiding symptoms, we got this symptom. Throat swelling is there. In external throat we have goiter, reflux. Here it is also represented. It is represented in Hering's also, and Allen's Keynote. Yes, of course, this is a central thread of this particular remedy. We go to abdomen, and in abdomen we have inflammation of pancreas. This symptom I have hardly seen in this particular grade anywhere, but if it is present in second and third grade, possibility in the guiding symptom cannot be ruled out. But then it tells us one thing very important, that this is a remedy which has got action on glandular system. Glandular system, whether it is a pancreatic gland, it is a testicular gland, it is thyroid gland, or it is submandibular gland or lymphatic glands. So that way pancreas is also one of the glands which is vulnerable. Now in abdomen we find pain, cramping, gripping. So this is somehow I feel would like to correlate it with ascariasis, the intestinal worms. In urine, we find urine is frothy, and frothy urine gives you clinical insight that there can be proteins are present. It usually is present in urinary tract infection, or it can be in nephrotic syndrome, but then it is a very, very rare kind of a symptom which we are coming across here. In genitalia male, you will find genitalia male induration of testis. Yes, of course, across the line. Helen is also having, Herring is also having, and Kent also confirms the same symptom. Genitalia male inflammation spermatic cord. It is also confirmed here. It is a very valuable symptom, it means. Genitalia male inflammation testis. Induration of testis and inflammation of testis. Inflammation acute and chronic is induration. Maltreated gonorrheal cases can bring about this kind of chronic inflammation. Genitalia male pain sore in the testis, pain squeezing in the testis. Male tubercles spinal spermatic cord. I am not very sure this tubercle can be interpreted in terms of tubercular infiltration or infection. Genitalia male tubercles testis. Now let us go to the larynx and trachea. Here we find larynx and trachea constriction, larynx sleep during, so sleeps into aggravation, droop night before midnight, respiratory system they are worse before midnight. Larynx and trachea, dryness of larynx. It is a very important confirmatory symptom. Now there is a pain in the larynx which has got different modalities. I have put it together. When it is worse, singing, swallowing, talking, touching, cough during. And it is a direct rubric. Again here, hysis larynx. We have hoarseness of voice. It could be because of two things. Post nasal drip, acute laryngitis or tubercular laryngitis. The treatment differs in three areas. Hoarseness is a common presentation, but if you are not been able to differentiate whether this hoarseness is because of postnasal drip or sinusitis, if it is because of acute laryngitis, exposure to cold air, or it is because of tubercular infection, you will not be having the right management system with you. Larynx and trachea, voice hollow. Let us go to the respiration, and here we find respiration anxious, asthmatic, and asthmatic, spasmodic asthmatic. When we talk about cough, we have got worse at night. It is a barking, croupy cough which is dry in nature and drinking after emulrates. Expectoration, membranous, very scanty. Chest, under the chest we have following rubrics: affections of heart, angina pectoris, hypertrophy of heart, inflammation of bronchial tube, bronchitis, murmur. So murmur is associated with cardiovascular system. Operation lying head low with, operation heart lying with head low, organisms of blood, on exertion, least exertion, and pain. So all the cardiac pathology and bronchial pathology is grouped here. We go to the chest, thysis pulmonalis, and weakness, exertion after. So here we find the tubercular laryngitis is not primary, it is secondary to pulmonary tuberculosis. That needs to be explored upon. And in extremities we have pain, gouty joint pains. So whenever you have gout, you have high uric acid. High uric acid is directly very toxic to kidney, and sometimes there are stone formations, gouty stone formation, uric acid stone formations are there, and kidney damage if it is there. which will ultimately result in hypertension also and proteinuria also. Sleep, dreams, anxious we have, and fever, heat in general. So friends, in skin we find itching, and generalities is lot many symptoms are given there, but then I have picked up only which are related to our primary area of importance. There is a induration of glands, so across the glands, whether it is parotid gland, testicular gland, it can be ovary, it can be pancreas. Orgasm of blood is congestive, kind of a circulatory congestion in the chest and lungs. Sleep after aggravation, yes, sleep after aggravation like paroxysmal nocturnal dyspnea, swelling of glands, again induration of gland and swelling of gland. Tobacco aggravates all cardiac conditions, all respiratory conditions. Weakness exertion from slide because there is a less amount of respiratory and cardiac reserve is present, so he is in the cardiac failure. And generally it is cold wind aggravates. So these are the central ideas which are represented in the Reversed Kent Repertory, and it makes a good profile of Spongia tosta. Taken together, these first grade rubrics create a sharp characteristic outline of Spongia, helping us recognize its presence with clarity in the real world cases. So friends, thank you very much for your patient listening and watching. Sharing is caring.